Go.
HIV affects men. HIV prevalence in Pakistan nearly doubled from 11% in 2005 to 21% in 2008.
$85,000 HIV positive cases in Pakistan.
1 in 5 injecting drug users have contracted the HIV virus since the start of the HIV epidemic.
Prevent and protect Pakistan. Use protection, get tested, get treated.
A brief history of Pakistan. Pakistan was created as the Muslim state of East and West Pakistan in 1947. The founding father was Muhammad Ali Jinnah. Muhammad Ali Jinnah was Pakistan's first head of state until his death in 1948. Prior to independence, Pakistan was part of the British Indian Empire, and in the midst of claiming its independence, hundreds of thousands died and millions were left homeless. In 1956, the Constitution was created and proclaimed Pakistan as an Islamic republic. In 2010, Pakistan suffered from monsoon floods. The floods were the worst floods that Pakistan had seen in 80 years. More than 1,600 people were killed, 4 million lost their homes, and more than 20 million people in Pakistan were affected. And then in April 2011, Al-Qaeda's founder, Osama bin Laden, was found and killed by an American Special Forces team in Abbottabad. So now I'll be going over my country profile. My country is Pakistan, and the purpose of this project was to bring awareness about the HIV/AIDS population outside of the US and other major countries. Pakistan has a relatively low HIV/AIDS population, but the number of affected people has been rapidly on the rise in recent years. As that article published, it's doubled from 2005 to 2005. The social demographics of Pakistan, this all came from the CIA's website. The population of Pakistan is 199,085,847, and that was last calculated in July of 2015. The age structure breakdown: 32.65% of the population is between 0 and 14 years old. 21.44% of the population is 15 to 24 years old. 36.28% of the population falls into the age category of 25 to 54. 5.28% of the population is in the age category of 55 to 64, and 4.35% of the population is 65 or older. The median age in Pakistan, which was calculated in 2014 for men, is 22.6 years old, and it is also the same for females at 22.6 years old. The life expectancy at birth for the total population is 67 years old. Around 67 years old, the accurate number is 67.39. The country comparison size to the rest of the world is 168. As far as the life expectancy, and then the life expectancy for males is around 65 years old. To be precise, it's 65.47 years, and for females it's a little bit older at 69.4 years. As far as ethnic groups go, the highest ethnic group is the Punjabi at 44.68%, and Pathan at 15.42% comes in second. Sindhi, that's spelled Sindhi, is at 8.38%. Muhars is 7.57%. Bolachi is 3.57%, and then other ethnic groups came in at 6.26%. The religion of Pakistan in 2010, the official religion was Muslim at 96.4% of the population as Muslim, and 85 to 90% of them categorized as Sunni, and the other 10 to 15% categorized themselves as Shia. The other religions for the rest of the population included Hindu and Christian, and they came in from about 3.6%. 3 to 6%. Education in Pakistan, its cost is about 2.5% of the GDP, and that was estimated in 2013. As far as literacy goes, the total literate population in Pakistan is 57.9%, and of that 57.9%, males came in at 69.5% and females came in at 45%. The government of Pakistan, the type of government is the Federal Republic government. The capital of Pakistan is Islamabad. The chief of state is President Mamnoon Hussein. The head of government is the Prime Minister Muhammad Nawaz Sharif. Pakistan gained its independence from British India on August the 14th of 1947. They do have a constitution. There have been several of them. The latest endorsed was on April the 12th, 1973. That was entered into force on August the 14th, 1973, and it was last amended this year. The Pakistani military is, it's the Pakistan Army, which also includes the National Guard, the Pakistan Navy, which includes the Maritime Security Agency, and the Pakistan Air Force. The GDP calculated in 2014, the Purchasing Power Party had $882.3 billion. The labor force in Pakistan estimated at 62.42 million people, and the labor force by occupation estimated in 2013, agriculture was the largest industry, coming in at 44%. Services was the second largest industry, coming in at 33%, and industry was the third largest, coming in at 22%. The unemployment rate in 2014, which is when it was last estimated, was 6.8%. The Pakistani budget estimated in 2014, it brought in $36.92 billion in revenue and had about $51.02 in expenditures. For the specific HIV and AIDS population, for the epidemiology, the adult prevalence rate is 0.09%. That was estimated in 2014. The number of people that live with HIV, which was calculated in 2013, is about 68,000. The total number of deaths to HIV and AIDS was about 2,800, and that was in 2014. And the country comparison to the world for that is 55th. Transmission, the most common form, 41% was through heterosexual sex, 17% was through contaminated blood, 4% was through homosexual and bisexual sex. Injecting drug users came in at 3%, and the mother-to-child transmission came in at 1%. The vulnerable populations are female sex workers, injecting drug users, and low sex with male-to-male sex with low condom use. The healthcare response, there's 12,929 registered HIV cases. Of those, 6,292 are on an antiretroviral treatment. 80% of those on ART are financed by the government of Pakistan. There's a total of 20 ART centers in Pakistan. There are 3 components to the education and prevention efforts in Pakistan. The first one is HIV prevention and treatment. There's targeted interventions for MARPs, which include the National Truckers Project and other small grant projects, HIV care and support, blood safety, STI control. The second component of that is advocacy and communication. Advocacy is getting out into the community and things of that sort, helping with laws that may silence people who have HIV, and then the other part of that is communication and stigma reduction. Some of the things that we face here in the States, people with HIV you're not gonna contract it by saliva and urine and things like that. And the last component is governance and institutional framework. So national and provincial reference laboratories, program management, and monitoring and evaluating how the programs that the government has put into place are doing. And since injecting drug users and female sex workers were such a big topic in Pakistan, I found a journal article published in the Journalism of Pakistani Medical Association, and it talked about bridge groups, which are they transmit HIV from core groups to the general population, and it's difficult in Pakistan to know who's considered part of this bridge group and who's not. But this article referred to the wives of male IDUs, which are the injecting drug users, the clients of sex workers and trucker bus drivers, may be pertinent to this group because they're the ones that are infecting a large portion of the population. And this article had some interesting facts in it. Nearly half of all injecting drug users are sex workers are married. And they are considered pretty vulnerable to contracting HIV and AIDS. This article also had a lot about the national surveillance data. And as far as sex workers go, they had some pretty interesting stats. Apparently 60 million sex acts are sold annually in Pakistan to about 3 million clients. And then lastly, this talked about the epidemic in the general population. There was little evidence of the general population of Pakistan is immediately at risk. The World Health Organization and the United Nations Program on HIV and AIDS estimated around 80,000 HIV positive cases, which was a little higher than what I had found, but my numbers were a little old from 2013. And then this also talked about the over 95% of Pakistani men are circumcised, which reduces the transmission of HIV and AIDS, and they think that that has has significantly reduced the number of cases in Pakistan. Women, a fifth of all diagnosed HIV cases are women. Many of these women, like I said earlier, are at risk simply for being married to the IDUs, which are injecting drug users. Most are not aware or lack the empowerment or skills to negotiate for safer sex practices because women still don't have as many rights in Pakistan as we do here in the States. And they also have limited access to treatment due to stigma and societal pressures and the lack of mobility to seek care on their own. Any HIV positive patients that are registered in the HIV centers come from conservative households and don't disclose their HIV status to their wives, and refuse to bring their spouses for HIV services. The last thing is HIV prevention and control. So Pakistan has a program called Enhanced HIV/AIDS Control Program. The government of Pakistan used about $70 million of its own and some donor fundings from 2003 to 2008 to implement these interventions to help control the HIV/AIDS epidemic, and a quarter of the funds were used for prevention and intervention for sex workers and injecting drug users, which are the two target largest populations of contracting HIV and AIDS.